Hi. So a lot of people these days are losing weight because of these medicines, or with bariatric surgery, or even organically with diet and exercise. So how will they need plastic surgery after their weight loss journey? Hi, I'm Dr. Rajat Gupta. I'm a board certified plastic surgeon working in Delhi. And today we will discuss about what happens when you lose weight either by medicines, bariatric surgery, or even organically. So, once you lose weight, you lose a lot of fat. I have had patients who have lost more than 60 kgs. They become half of what they were. But eventually, whether you lose 10-15 kgs or even up to 60 kgs, what happens to that excess skin? So once you lose fat, the skin sags. The skin which you have at certain other body parts will definitely sag. Each individual will have tendency of one body part to sag more than the other body part, and that depends upon individual to individual. But what all areas sag? I've had patients recently, in recent times, a lot of facelifts coming because they lose fat because of Ozempic and Mounjaro medicines, and the skin sags for face and neck. Similarly, for women, the breasts, even for male, the chest skin sags. Tummy, very common. The abdomen skin sags completely. For buttocks, a lot of patients come to us with buttock sagging. Thighs, and even arms, the skin starts sagging. So how do we correct these things? Basically, one has to understand that when these patients gain weight, they were fat, the skin expanded along with the fat. When the skin expands and you take away the fat from beneath the skin, what happens to this excess skin? It sags. And what needs to be done? You need to now remove that excess skin. For a very subtle increase in skin, you can use technologies which are non-invasive or minimally invasive, like RF skin tightening or HIFU over the skin, or RF skin tightening from beneath the skin, like Body Tight, Renuvion, so that the skin gets shrinked and tightened. However, for slight increase in skin excess more than what you can tighten with non-surgical tools, anything which has much more skin excess, you will have to remove that excess skin. Now, excess skin removal is, we remove that excess skin, excise that excess skin, and of course, whenever we cut the skin, you will have some sutures. Some repair work needs to be done to stitch the skin back. Plastic surgery is a specialty in which we try and hide the scars as much as possible so that the scars are invisible or less visible. So especially we talk from top to bottom, we talk about face. The skin sags, we do a facelift surgery in which we take the concision in front of the ear and then go inside the ear, then come out and take it behind the neck. Now, the scar initially visible, but of course over a period of time fades very nicely, and you can actually lift the whole skin up and give you a nice shape and result. Similarly, if we talk about chest, we try and hide the scar around the areola, or may give a vertical scar also and give you certain ointments to apply and laser so that the scar fades nicely. For abdomen, we give a tummy tuck, move that excess skin, and the scar is called as a bikini scar, hidden in the undergarment, nobody can see the scar. For thigh, we give the scar in the groin crease or may extend in the inner part of the thigh so that it's less visible. Similarly, in the arms, either in the axillary fold or inside the arm so that it's not visible from front or back. So these are the procedures which people will need when they lose excess fat, especially in a short span of time very quickly, because the skin does not shrink back and it sags. Now, if you are wondering that you are someone who want to lose weight and whether you will need this surgery or not, and you are hesitant, please understand, if you need to lose weight, please lose it. And if you end up having excess sagging skin at certain body parts, we are there to help you. Don't worry about it, and we will restore your youthful look. If you have any more questions about this, about what happens after massive weight loss or any other cosmetic plastic surgery, please connect with us. Me and my team are always there to guide you honestly and scientifically.